Let's talk about antibiotic prophylaxis on L&D. So if we are trying to achieve antibiotic level, therapeutic and level of antibiotic in the amniotic cavity, these medications should be used. In the case of GBS, ampicillin, cephalosporin, clindamycin, vancomycin, azithromycin, or aminoglycosides. 30% of GBS is resistant to clinda and azithro. Antibiotic allergies, anaphylaxis to penicillin occurs in 1 in 10,000 patients. Less severe forms in 10% of patients. Cross-reactivity to cephalosporin is around 10%. For C-sections, pre-op vaginal cleansing in laboring patients or those with ruptured membrane reduce the risk of endometritis and post-op fever, but not wound infection. Per ACOG, this should be done. For CDC, they suggest all C-sections have vaginal prep. Okay, use either 30 seconds of 10% povidone iodine or low concentration of chlorhexidine gluconate. 4% is safe. Single dose of first generation cephalosporin is first line. We can give cefazolin 2 gram IV regardless of weight of the patient within 1 hour of incision. If patient is allergic, we can give clindamycin 900 milligrams IV times 1 plus gentamicin 5 milligrams per kilo. If not, if the patient is undergoing non-elective C-section, we can give azithromycin 500 IV over 1 hour. If the patient is obese, and if they did not receive the azithromycin pre-op, we can consider 2 days oral course of 500 milligram of Keflex and 500 milligram of metronidazole Q8. If patient is MRSA positive, vancomycin is added on top of recommended prophylaxis. PPROM less than 34 weeks. We do IV ampicillin and erythromycin for 48 hours, then PO amoxicillin plus azithromycin or erythromycin. This reduces RDS, necrotizing fasciitis, intracranial hemorrhage, and sepsis. Ampicillin is 2 gram IV. Erythromycin is I gotta look it up again. Anyways, prophylaxis for endocarditis only in high-risk patients, such as patients with cyanotic cardiac disease, prosthetic valves, prior history of infectious endocarditis, mitral valve prolapse is not considered high risk. Antibiotic given 1 hour before anticipated delivery. Repair of 3rd and 4th degree will give 1 single dose of 2nd generation cephalosporin, such as cefotetan or cefoxitin 2 gram IV or clindamycin. Cervical sarcoidosis, we do not recommend antibiotics. Increased risk for endometritis after manual removal of placenta during C-section. common to give antibiotics after manual evacuation of placenta after vaginal delivery. However, there is no data supporting this.